So thank you very much. I hope the mic works. The next 25 minutes or 20 minutes, I'm going to take you to health tech and healthcare. It's a bit of excursion. My background is, actually I'm from business, but I have been in health tech and healthcare since 1999. And I literally started the first company and my path in the basement of Tartu University. We had one laminar hood, we had one customer in Tallinn, fertility clinic, and it was supposed to be a very short trip for me, but I ended up being there for 13 years, and at the end of this journey, we sold it to the biggest European lab chain, Synlab. Since then, I've been doing investments in the capacity of angel. We have accelerator, and recently I have joined the first global early-stage health tech fund, Verge. I'm going to go through these numbers very quickly and just say one thing. In health tech, in addition to financial returns that you want to get, you want to impact lives. And I'm very proud of what we have done up to today. More than 53 million people around the world have been using the solutions that we have helped to build. And this is a really good feeling, because in the health, in addition to financial returns, the impact that you can save lives, you can increase the health span and lifespan, this is what makes a very big difference. I'm going to talk to you about two things today. First of all, healthcare and the trends that are predominant there. And then I'm going to talk about health tech, how the technology is and can change the healthcare. Close to 80 years ago, WHO defined the health in the constitution of WHO. And please pay attention that how they have done it. Please pay attention that in addition to the physical point, here is mental health and social health mentioned. And another thing that is mentioned is that it's not only the disease or the presence of disease that says, are we healthy or not? But it's something more. Close to 8 years ago. And we have failed actually miserably, regardless where we are. Globally, we are missing 10 million doctors. Globally, we are missing more than 30,000 hospitals. Globally, more than 10% of the medicines are fake. And globally, more than 100 million annually, the people are pushed into poverty because of poor health and poor healthcare. Yes, for us here, it may seem that this is not our problem. This is the problem of someone else. But think about what has happened during COVID times. In a couple of weeks, we were all left without the proper support of healthcare system. Pretty bad, huh? So let's look what are the trends and what are the reasons why, as the societies, we have failed on that. One of them is aging. And I think that this is the biggest trend that has been actually shifting the focus of the healthcare and will shift actually the focus of the healthcare during the next decades. Look at the yellow layers of this. These are the people who will be in 50s, 60s, and 70s in the near decades, and they will be needing very different healthcare than our healthcare system has been providing. Why do I say it? Basically, any disease, any reason why we go to the doctor can be divided into three areas. These are injuries and traumas, these are infectious diseases, and these are non-communicable diseases. This graph you should read in a way that the bigger the rectangle is, the higher the cost to the society, and the intensity of the color shows the growth of the cost of that. You see that, that actually the vast majority of the costs in the healthcare are not related to injuries. They are not related to infectious diseases, but they are related to the diseases that we may say are lifestyle dependent. So whatever the doctors do, whatever the doctors and nurses do in the hospitals, it's not enough. Why? Because the determinants of the health of non-communicable diseases are outside the reach of the traditional healthcare. It's actually our behavior, our social status. It's about genetics, not what the doctor or nurse is telling you to do when you have acute episode of the disease. If we go even further, then if we take a lifestyle disease, then before getting really sick, we go through several stages of the development of the disease. In 20s, we hopefully come to the life and we are still pretty healthy. Then something already is starting to change within the body without us noticing actually any change. At some point of time, we already feel fatigueness, we feel chest pain, we feel maybe headache, shortness of breath. But still, we are not patients for the healthcare, because the doctors and the health systems are set up in a way that they are ready to treat us only if they can diagnose us and only if there is acute episode of the disease. So my question is, who is really dealing in the society with the early stages of lifestyle diseases? And I must say that there is no country in the world who has really solved this issue. All our health systems are actually set up to treat acute episodes of the diseases, and all our payment systems in the society is built up to finance that. So traditionally, it has been the wellness industry or the traditional medicine. And it is a huge industry, by the way. It has been more than 5 trillion globally. From the other side, the healthcare industry is even bigger. It's 9 trillion, close to 10% of the activities of the humankind. Thanks to the technology development, we are now seeing that a new marketplace is developing that we can call personalized health industry. We still don't know very many parameters of that industry, but that will be the marketplace where new type of prevention, new type of intervention, new type of solutions will be adopted. And as you see, our doctors and nurses, they are trained to deal with you when you're here. But what about these 15, 20 years before that? We don't have the solutions at the societies. And there are different companies who are actually coming into this new marketplace. First, the big tech companies. You may have heard Apples and Googles and Amazons and Microsofts of the world who are providing their solutions into this industry. You have seen the device manufacturers moving away from the doctors, selling their devices to the doctors and hospitals. Philips, Boehrer, Garmin, Polar, Oura, they are all consumer brands. Then the pharmaceutical companies noticed that, hey, we have to be there. And the fourth group are the incumbents of the industry, clinics, labs, specialists, pharmacists, hospitals. All of them have now noticed that they have to do something. They are not prepared for that. And we can help as a tech community. But the new industry is emerging, and I think that everybody who is here listening to this have something to say about it and may actually be part of the solution. So, from the healthcare point of view, approximately 4 billion people around the world don't have the access to quality healthcare. The disease burdens have shifted from the infectious diseases and injuries to the non-infectious diseases. And what is super important, as I said, is that the origins of these diseases are super different. So we have to be prepared for the change. What is health tech? Health tech is the set of technologies that actually can help the industry to change. The industry has been, as I said to you, diagnosis, treatment, and post-acute recovery. Now, what we are talking about, we are talking about prevention, we are talking about detection, we are talking about healthy aging and longevity. By the way, the lady here, who thinks she's in 60s? Raise your hands. Who thinks she's in her 70s? 80s? 90s? This person is Ernestine Shepard. She started bodybuilding at the age of 71. And this is the picture taken of her when she's 85. Currently, she's 86. Great, huh? And we have different solutions already out there in the market that actually help us to shift the care outside from the physician's office to the homes, to our workplace, to the remote areas of specialists, and to the elderly. So what we see is that these technologies actually help the health, or generation of health, move from in-person healthcare into the everywhere. It can happen everywhere, at home, here, in the elderly homes. It has to be, it has been very manual and siloed, but it's going to be digital and connected. It has been really treatment-centric, but it's going to be more preventative and pervasive. And I think that kind of the promise of the health tech is that it can really be health and care. Because let's be frank, our systems currently are actually the sick care systems, not the healthcare systems. The first generation of health tech has been very much enterprise-facing. So the solutions have been sold to doctors, to hospitals, and anyone who is performing the service to the end user. And you see here one division of the services, and these solutions have actually been around for decades already. What we see now is that more and more solutions are actually directed directly to the end users or combined that will bridge this decision-making that's happening at home with the decision-making that is happening in the doctor's office. So from the functional point of view, health tech is really one of the enablers that help the shift where the decisions are made. And by the way, in order for us to make this shift happen, we have to generate trust. We have to generate the trust in the system that whoever has been making the decision, for example, doctor, and the decision-making is now shifted to the nurse, to the patient, to the family member of the patient, or to AI. We cannot forget the doctors at all, and that's why we have to generate the trust among the doctors that they will be happy with this information. They will be happy with this decision making. And the tech companies who are here, they can actually make this happen. A couple of words about the business plan or the business models. So there are three main models how the health tech companies can monetize their solutions. Usually, you start by saying that, hey, I have an app, I want to sell it to the end user. Classical direct to customer, right? The problem in health tech is that it is very slow. And by doing that, it's very difficult for the doctors to trust this. So the adoption of these solutions have been really slow. That's why the next logical step for the companies is to start selling the solutions to relevant stakeholders. They may be the doctors, they may be the clinics, they may be the insurance companies, or they may be some service providers, integrators, who are providing some other service to the participants of the industry. This can result in a very good business, but it takes a lot of time to persuade the clinician, to persuade the insurer, and this is very big business, but it takes a lot of time. And the third way to monetize, broadly speaking, for a health tech company is that you don't charge directly anyone, but you sell something else. Of course, this is a simplified model, but basically, if you are thinking about developing your solution, then you should kind of think what is your way, how you're going to monetize this. And again, you're going to sell the solutions here in the new marketplace, or maybe in the adopted marketplace. And if you want to really see where this marketplace may go, then you may want to search Google this article from Andreessen and Horowitz. And long story short, kind of the point of this article is that the landscape of health tech or healthcare is several times bigger than the landscape where currently the tech companies are playing in. So we may very well see that actually the health tech company will be the biggest or one of the biggest companies in the world. It's some 10 to 12 minute read. So if you Google it, you are certainly able to see this and find this. So this is my final slide, and hope you have some questions on my presentation. So the health tech is actually transforming, or the healthcare is transforming from sick care, reactive, to proactive health and care. The decision making will be democratized, and maybe this is one of the biggest opportunities and challenges. Because going to the doctor used to be like, the decision making was like a black box. Whatever the doctor told you, you had to do it. You didn't have any understanding whether this is right, whether this is wrong, but you did it. Now you can Google and you can challenge the doctor, even if before he or she tells you something. So the decision making will be certainly democratized. And this is a definition. Health tech is actually the set of technologies that can take this decision making more democratized into the house, into the home, into the office. And it is a very complex way because the data and the internet and the technologies have to be mixed all together. There is no one solution. The last point I want you to take home from here is that when you compare, for example, healthcare to hotel booking industry, where this transformation, digitalization has happened, and when you think about it from the perspective of the homogeneity of the process that is digitized, then regardless whether you want to find $20 Airbnb apartment, or you are ready to pay $1,000 for the hotel night, the process is very homogeneous and very simple. And it's natural that you can break things and deal with the consequences after that, if you are a startup. But in healthcare, health tech, there are tens of thousands of procedures, and there are hundreds, if not thousands, of diseases and diagnoses. So, and there is no one way how you can digitize it. So it is much more fragmented place where you are doing it, and that's why the traditional approaches that you may see in other industries are not working. We are still very, very early in the health tech field. The health tech was first actually mentioned more or less 10 years ago, 2013. So we are just getting into our teenager life. So teenager life is really interesting from the perspective of who is living there. But you may expect a lot of changes in transforming this industry into a mature industry. And I personally think that we are very close to the inflection point. Why? Because the traditional systems are very much under the different pressures: financial pressure and social pressure. The new generations with different expectations are coming in, and this gives a huge opportunity for all of us to be part of the change. So thank you very much. If you have any questions, then let me know. Thank you.
Thank you very much. We do actually have a question in as well. The question is, what do you think should be the first steps for a traditional medical company to move to the new healthcare? If you were in charge of such a company, what would you do?
First of all, I suggest to take a portfolio approach. So, because if you put all your bets on one solution or a couple of solutions, you may burn your fingers badly. So think about a portfolio approach, partner up with people who are in the industry and learn a lot.
Okay. No more questions, by the way, from anyone else, so I'll ask one myself that I was interested in. So we were talking about bringing this health tech into homes and into people's lives more. Who should make the approach to make that more sort of appealing to people? Is it the companies themselves, or do you need to get the doctors more involved, or where is that sort of process of what are the steps going there? Because the people won't just magically find it if it...
Yeah. I think that technology is certainly an enabler here. The promise that the Oura rings and the wearables give us, it's really lucrative. So I think that we as the consumers, we will be driving this. The problem with the doctors is that they have been graduated or learning for the science of art, for the art of medicine for tens of years. Okay, and I think it's very logical for them to expect that they know much more than us. So building trust, building awareness, and showing that actually it's not the binary. It's either with doctors or without doctors, but it's more like a stepwise process. I think that this is very critical to get this information to doctors, to nurses, to payers, and to the heads of the hospitals.
Okay. And while we actually get we need to get some chairs in for the panel as well, I'll ask you one extra question. What do you as an investor want to see in a health tech startup?
I want to see a strong team. And by strong, I mean open-eyed team who is really ready to discuss and who is really ready to acknowledge the shortcomings and really develop and change the team. So this is one thing. And the second thing, what I want to see is that in the technology part, there has to be something that can be protected against the copycats. Okay. So there should be some kind of barrier why the others cannot do it.
Okay, thank you.